tips and trends on parenting. So feel free to join our Viber community, of course, the Viber community too, and we will be posting the link on the comment section. So let's wait for a few minutes for other viewers to join us. As we wait, we want to, of course, to make this session exciting for everyone. All right. Of course, we'd like you to know that we partnered with Nursery Van, so your go-to one-stop shop for all baby and parenting essentials. All right. So again, please make sure. Oh, all right. All right. We think. Okay. Oh, okay. So sorry about the first part. If you guys weren't able to hear that, the audio difficulties, technical difficulties. So we'll be right back to fix that. So don't go away. We'll be right back. Can you hear me? Can you
Muted, Dasha.
Hey, hey.
I can hear you.
Hi. I can't hear you guys. Hello. All right, guys, we're back. Hi, everyone. Welcome again, and welcome to No Compromise Parenting Mother's Day special. So, are you guys here? You with me? Thank you, guys. Yay, we're back. Okay, technical difficulties, but then we're done. We're over that. So, let's move forward now. So, yes, I am Natasha Ventura Reyes, and I am a freelance licensed real estate broker, and I'm the mom of Eva and Zari. Eva is 14 and Zari is turning 5 this month. And I'm so excited. I'm very excited, as you can see, to be part of today's discussion brought to you by No Compromise Parenting. And of course, No Compromise Parenting is a community for new generation parenting where you get tips and advice to help you become the best parent you can be. So last week, teacher Tanya and PT Anna talked about different activities that you can do while at home because, we're basically just home all the time. Stay home, hashtag stay home, stay safe. So we will continue to provide you with interesting topics and in the coming weeks as well. So feel free to reach out to No Compromise Parenting if you have any topic in mind. All right. Sorry for the technical difficulties a while ago, but you're back again. All right. So guys, please make sure to follow them on Instagram at No Compromise Parents and like their Facebook page as well for the latest tips and trends on parenting. And feel free to join our Viber community too. So we will be posting the link on the comment section below. All right, so let's just wait for a few minutes for the other viewers to join us. And as we wait, we want to, of course, make this session exciting for everybody, for you guys. And so we partnered with Nursery Van, your go-to one-stop shop for all baby and parenting essentials. And throughout today's session, we will be randomly giving out gift certificates from Nursery Van, of course, to 4 lucky winners and lucky viewers, up to 2,000 pesos. So please participate, and you might just be the winners. It might be the lucky 4 viewers who will win these GCs. All right. So we'll be announcing the winners later. So make sure to stay with us until the end of the live of our live stream. So here we go. So all right. So okay, we all it's actually guys everybody. It's actually a good thing that we have these webinars because at least something to do when you're just home. At least you can just check it out and learning while you're home, right, guys? All right. Okay, so we all know that the pandemic, this one has it's been going on for 2 months already, right? And you feel it. I guess some of you are like feeling the boredom already, saying, what else can you do at home? And it has become a huge source of anxiety, especially for the moms and it's expecting moms and the moms and the kids also they stay home, but especially for the moms because they just try to stay indoors and they make sure our family is protected against the COVID. And since Mother's Day is coming up, and that's this Sunday, so advance happy Mother's Day, everybody. I mean, to all the moms out there. So we wanted to dedicate our session today to all the new moms and moms to be to help them in addressing any anxiety during this difficult time. Okay? Despite all the anxiety and with everything that's happening, we try our best to stay positive and strong in all together, especially now that Mother's Day is coming up. So let's just try not to focus on the stress and whatever boredom and just look forward to it. Let's be excited. And this is one way for us to help also by having this session. So apart from today's session, we have exciting surprises ahead in partnership with Nursery Band for everyone who are with us today. So make sure to stay tuned for that. All right. Okay, so we all wanted to be so excited because we are also excited as well. So just to excite everyone, let's draw our first raffle winner. Okay, guys. Our first lucky winner gets 500 peso worth of GC from Nursery Band. And the lucky viewer is, are you ready for this? Miss Maria Charlene Isidro Agabao. Woo! Congratulations! So just stay tuned and we'll let you know how you can claim your GC later. So we'll post it here. All right. So congratulations, Miss Mommy Agapang. Congratulations again. All right. So we shall begin now. So watch out for the details how to get it later. So for today, to discuss today's session, it is with pleasure that we introduce Dr. Jamie Isip Kumpas, pediatrician and international board certified lactation consultant, and Dr. Giancarlo C. Santos, OB-GYN and Lamal certified childbirth educator. All right. Dr. Jamie Isip Kumpas is a pediatrician and an international board certified lactation consultant trained at the Medical City and Johns Hopkins Bayview Medical Center for lactation training. Currently, the chair of the Breastfeeding Committee of the Philippine Pediatric Society, BPS, she is busy organizing breastfeeding programs, providing lactation consultancy, and treating sick and well kids at her main clinic at the Parkview Children's Clinic in Makati. Right. And Dr. Gino Santos, of course, completed his medical degree at the University of Santo Tomas and training in obstetrics and gynecology, as well as ultrasonology at the Medical City. He has also been a Lamas certified childbirth educator since 2016 and is passionate about informing women of their options at birth. And both Dr. Jamie and Dr. Gino are part of the Whole Health PH, which is an integrative multidisciplinary clinic that aims to treat illness by empowering patients to address the root cause of their sickness in a holistic manner. So Whole Health PH has specialists in pediatrics, OB-GYN, dermatology, ophthalmology, and functional medicine. All right. Okay. So moving forward now. So as I mentioned earlier, we know we have a lot of new and excited and expecting moms out there who have tons of questions about pregnancy and childcare during this time, especially. So just wanted to know, of course, I'm sure you guys all want to know, what are the basic but must know facts about this virus, Doc Zeno, if I may ask? Hello, Doc.
Hello. I hope to give that and in a concise manner in one of the first few slides, but I think in general, pregnant women have it good naman. So that should be something positive about being pregnant at this time.
Mm. Like I'm sure with your topics you'll be able to share like info on how they can, the basics na for now, while during this time especially,
Yeah.
being pregnant and about to give birth at this COVID time.
I hope I do kasi I'm sure they face a lot of challenges. Parang the ease of access of getting consultations before is not the same anymore. What with the lockdown. So I hope
Correct.
with the short talk that we're going to be giving, I hope I get to address that. And I hope that maybe they get some stuff that they can use, that you all can use in the small decisions that you make every day. Para you guys are also
Right, Doc.
reassured and more comfortable in your pregnancies and birth.
Right, Doc. And thanks for being here today, Doc. So,
Thank you for having me.
thanks. Doc Tino and Dr. Jamie, of course. Thank you guys. All
Thank
right.
you, Tasha.
Thank you, Doc, and welcome, of course, to this very fun and exciting topic session today that we have. So thank you, both of you. Thank you so much. All right. So, Doc Tino, I'll start with.
Okay, so thank you.
Thank you.
My talk's gonna be about pregnancy, birth, and basic newborn care during the COVID season. I'm Gino Santos again. Hi and good evening. So just before we start talking about the COVID, let's get to know our enemy a little bit. So COVID-19 now it belongs to the family of the coronaviruses, and they're all under the family of SARS, of MERS, and these are just some of the outbreaks that we've had before ever since 2002, 2012. Initially, the coronavirus during the time before when we were still looking it up, it was just this respiratory virus that caused around 15-30% of upper respiratory tract infections for the general population, and it wasn't notorious as it's but suddenly with the SARS, with the MERS, and now with the COVID, I think the coronavirus name is gonna be it's gonna be a household name now. So in general, what I want you to know is that COVID-19 is the name of the disease, and that the name of the virus causing it is SARS-CoV-2. So I guess they're trying to establish the link talaga to the original SARS, which was caused by SARS-CoV. So the mortality rate of coronavirus of the COVID-19 so far in our country is around 6%. So fast facts about the COVID, transmission is usually through respiratory droplets. What that means is it's the stuff that comes out when you sneeze, cough, or talk. And this is the reason why surgical masks are now advocated for all people going out. And just in case that you're one of the few people or you find yourself in a situation you don't have that, it's very important that you maintain distances, a certain distance from each other, around at least 6 feet. Some of the recommendations will say, some will say a meter, but I think just try to keep safe distancing. And if you're on the other end, if you're the one who's coughing, who finds yourself coughing or sneezing, it's best to cover yourself, your mouth, with a piece of tissue or cloth. Or if push comes to shove, wala ka talagang dala, I think maybe you can cover your mouth with your shoulder. And the incubation period for this disease is 1 to 14 days, meaning the time na nadapuan ka ng virus up to the time that you manifest the symptoms of having the virus can range from around 1 to 14 days. So it's very important. This is very important because one thing about this virus is sometimes you get it and it doesn't mean that the next day you're going to get the symptoms right away. So you can have the virus and not exhibit the symptoms. And this is what can be more difficult to avoid when dealing with other people, the asymptomatic spread of the virus. Symptoms, I'm sure everybody knows, is fever, cough, and fatigue. These will be the most common symptoms of this virus. So the severity of infection, majority of the pregnant women and new parents nowadays will be falling under the mild or moderate illness. And these can include some mild symptoms of the fever and cough, and up to like sometimes mild pneumonia, but nothing that requires extraordinary treatment or measures. The more minority will belong to the severe and critical group. Being the biggest risk factor for severe illness will be age. So falling under the reproductive age group of you guys being pregnant or being early parents, is in itself already one of the biggest um, good things, I guess, that you can have during this time, because it can really be not naman protective, but maybe if you do get the disease, you will be more likely falling under the mild, moderate severity of infection. And for these people, complete resolution is expected. Testing, as you know, is RT-PCR, and there's a whole lot of problems when it comes to the diagnosis. If you guys are try to keep updated with the news, treatment in short, wala pa. Okay? So fast facts on COVID-19 and being pregnant. So this is the part that matters most to us. So I try to make it very simple so that we can all find out about it in one slide alone. But the cost of this is that you have to remember that this is like a snapshot of May 8 at 6:30 p.m. So this is what we have based on the research right now, and it can definitely change. And this is the reason why it's important to be updated. But in summary, just to keep things simple, are pregnant women more susceptible to getting the infection? The answer is no. Is the infection more severe among pregnant women? Interestingly enough, the answer is also no. Because when it was the SARS and the MERS that we were talking about before, yung mga family members of the coronavirus, of the COVID, it was usually worse for pregnant women. But interestingly, for this virus, it's not more severe among the pregnant women. Is testing required for all pregnant women? Protocols vary, but don't be surprised if upon giving birth, some hospitals will require you mandatory, whether or not you have symptoms or you do, to get yourself tested with the RT-PCR. Can infection be passed from infected mother to unborn fetus? Very important, and I'm sure this keeps a lot of the moms awake at night. But the answer is unlikely right now. There are no studies that can show evidence that this virus has crossed the placenta and into the baby. So it's beautiful, I think. It's very beautiful that pregnancy is protects babies that much talaga. Can COVID-19 during pregnancy cause congenital defects? Unlikely. We have no evidence of that at the moment. Is COVID-19 an indication for a CS? And the answer is no. Okay? Prenatal care during the pandemic. This is a time that is difficult for a lot of women because maybe they lost contact with their previous obstetricians, especially those with whom they had no contact with outside of the clinics, or maybe they just don't know where to go because the clinics that they were in are closed. So, in general, the changes in prenatal care, the styles of prenatal care now can vary from one doctor to another. My suggestion maybe for the pregnant women out there is to be open to teleconsults, because as doctors, of course, they want to reach their old patients also, but at the same time, prevention of disease spread is top priority. And if the doctors, based on some teleconsults that they make with their patients, deem that it's not necessary for the patients to go out of their house and get themselves exposed, definitely some of the things can be managed via teleconsult. Also important, if before going to the clinic or the hospital, it's very important to call or tell your doctor or the facility that you're gonna come in there. Okay, companions, heads up to the pregnant women out there. Companions are generally discouraged during visits, especially the face-to-face consults I'm talking about particularly, unless the partners or the companions are vital to the care. And now, more than ever, it's important that you be more involved in your care. Meaning, sometimes it'll be more, there will be no other choice but to take your blood pressure by yourself or to
Mm,
weigh yourself to determine how much weight you're gaining. So it requires a little
right.
bit more attention from the moms and the pregnant women. Okay? As per nutrition, weight gain, and exercise, in general, if you guys take a look at the slide, normal women before getting pregnant who have BMIs within the normal limits are expected to gain around 25 to 35 pounds during the course of the entire pregnancy. So that's so much. So it's important to know that as pregnant women, whether you were obese or whether you were super skinny before getting pregnant, all of the pregnant women are going to gain weight, and they're expected to gain weight. Losing weight during pregnancy is not healthy. So what it's a matter of is whether or not you're expected to gain a lot of weight, as is the case if you're underweight, or to gain a little weight na lang if you were obese to begin with.
Doc, question. Quick lang. Before, so when I was pregnant, I
Um,
was told na
yeah.
normal 20 to 25 pounds. But I remember
Uh,
before when I was pregnant, mga 20 to 25 pounds yung normal
yeah.
daw. But now it's So that's a
It's actually a range, eh. It's actually a range. In
mm,
general, kasi before, what we stuck to more was how much weight you were to gain every week. And maybe sometimes,
mm,
if we kasi diba in the usual dictum is by the second or third trimester, we're expecting the pregnant women to gain around more or less 1 pound a week. So sometimes that
mm,
if you add that up, it adds up to 20 to 25. So sometimes it's because of that, but sometimes it's just a shortcut or maybe easier than to remember for the pregnant women. But it's interesting to know lang na it's a range. And
mm.
if you look
Okay.
around you, the women around you, everybody, they come in different sizes, especially during pregnancy. So even if you have similar diets or activities, weight gain can still vary and how their bodies will accumulate the weight. But if you see this
Mm,
slide, the body is distributed in different areas naman of the body. So
right.
some women will see their bodies negatively, but it's important na to understand that it's actually, well, in my opinion, right now, as the speaker,
Mm.
is I find it beautiful because your body is preparing itself to be a factory to produce another human being, di ba? And it's bracing
Yes,
itself
Doc.
for the work that it's about to do, for the nutrition it's supposed to provide your baby, for the birth
Right.
process, and for breastfeeding. It's all actually a chain.
Correct.
So,
Agree,
however,
Doc.
even if di ba, pero even if I say this, if you find yourself having negative feelings about your self-image, the best thing is still eat healthy, a balanced diet, and to maybe seek the companion of good friends or family members that can maybe help you back on your
Yeah.
feet. Okay?
Right. And different experiences and with the pregnancy, different experiences, right? So like my experience could be different with the weight gain or not. So
Yeah, and sometimes some
iba-iba.
women who exactly, and it also, I'm sure it can also affect you if you found yourself comfortable with the weight. Not only the
Mm.
appearance, pero it was it harder for you to walk, to sleep? Did you get
Yes,
good
Doc.
night's sleep, di ba? All these things
Yes.
can affect the way that you think about yourself. Eh. And I'm just
Right, Doc.
reassuring you na when the time comes that you give birth, it takes around 6 months for you to resume your normal pre-pregnancy weight. So it does come
That's
back
good.
to normal because it requires a lot
Mm-mm.
of calories just to make breast milk. So it's
Yeah.
all a cycle talaga. It's nothing. You're not fat. I think
Thanks, Doc.
you can't call a pregnant woman fat because it's gaining weight
Yeah,
to
no,
support a baby. Not it's
never.
not you can't.
Correct.
It's just oil and water. Hindi pwede.
Right. Tsaka water retention lang. So it's good to know, Doc. Thanks a lot.
Sige, we'll call it water retention.
Okay. Thanks, Doc.
Okay, so for nutrition, in general, eat a rainbow of natural food colors. If you want to keep it easy, it's just a surefire way that you're getting a variety of vitamins and minerals that can be important for you. Also, enjoy what you eat. Eating well shouldn't be too complicated. Eh. And when you realize that you're eating for two people, maybe you can find yourself enjoying what you eat more without too much of the guilt. Because remember, when you're pregnant, you're expected to gain you're supposed to consume around 80,000 calories for the whole pregnancy, and that's around 200 to 400 calories per day by the time
Wow.
you're in the second or third trimester. So it's a lot of food, and so I'm just telling you this maybe that you can find yourself less guilty when you eat food. Okay, eat when you are
Okay,
hungry
Doc.
and stop when you're full. It's the stopping when you're full that's actually a lot of times difficult because minsan marami pang naiwan na food or sometimes the food's just really
Yeah.
delicious or what. So it's these things that but if you say it simply, stop when you're full, it's actually gonna help you through this. Eh.
Okay.
Okay. Exercise in pregnancy, the recommendation is at least 30 minutes of moderate exercise in most, if not all, days of the week.
Mm.
And what's advised is low impact aerobic exercise, but the best one is actually swimming. But because of the
Mm.
virus now,
Swimming.
it can be
You
difficult to
cannot.
find a swimming pool unless you're blessed and #blessed enough to find yourself having a swimming pool. But there are a lot of other
Mm-mm.
alternatives. Like you can walk around the house. There are a lot of videos online on YouTube, and you can use those to find videos for pregnant women. What's important is some guidelines lang. Begin slowly and gently, and increase the resistance or the effort gradually. Since you're gonna be trying a lot of the exercises online, I'm sure
Mm-mm.
generally if it hurts, stop and evaluate what's wrong. Am I pushing myself too hard? Are you already injured or something? In general,
Mm-mm.
avoid things that require a lot of balance, especially if you're in the third trimester, because these are tricky things, especially when you're pregnant. If it feels good, it probably is. So one thing I'd like to emphasize is number two. If you're exercising too hard, you can find out if you're doing so via the talk test. And the talk test is generally
That's
if you find yourself having a hard time talking with somebody or gasping for breath as you're having a conversation, then that means that you're exerting too much effort and that you should take it a couple of notches lower. Okay. So if you're
mm,
exercising, talk test. Also, keep hydrated, very important, and try to find clothes that support and fit you well. You'll know it's too tight if there are garter marks on the below the breasts and by the waist. Okay, it
wow,
matters.
yeah,
It really does matter. Alam mo, like a lot of women
skip
really,
na pala.
yeah, they just don't notice. But it can really affect
Mm-mm.
your performance. Don't
Okay, but
exercise if you have the following. It's
okay.
very important. So it's a lot, but for majority of women, they won't have any of these actually. So a lot of you can actually exercise at any time. If you're in doubt, you can always ask your doctor for some more detailed advice. Okay, and I think it's important that you don't hesitate to ask your doctor.
Okay.
Signs of labor. We're speeding it up now. So signs of labor in general are contractions. So it's important to tell whether you are having progressing contractions, which we'll talk about later, and Braxton Hicks contractions. So I'm sure you've heard of it some one way or another. Braxton Hicks contractions talk about false contractions. These are contractions that are associated with false labor. They don't change in intensity, so it lasts a long time, usually of mild, moderate, or sometimes even um, strong. You can even have strong contractions sometimes. However, it doesn't progress. It doesn't become more frequent, and usually disappears with sleep. Bloody
Mm,
vaginal discharge, yeah, can be a sign of labor. What is bloody show? Bloody show talks about when you pass bloody discharge that is more mucus-like than bloody or watery. So the mucus blood comes from the this part of the cervix, okay, and it's sign that your cervix is starting to open. So it can definitely be a beginning sign that labor is happening. Okay? Sometimes your bag of water can leak, and definite sign of labor is a dilating cervix, which can be confirmed by your doctors when you get yourself checked via an internal exam or an IE, which does not make a lot of women happy. But it's really for us to really be to find out
I
if you're
remember.
progressing. And yeah, it's the IE talaga. So far,
Yeah, so
wala pang na-invent ngayong 2020 of a better way to find out how far you're progressing into labor. But I
how?
challenge everybody na baka may there's a better way, less uncomfortable way for women. I invite you. No, we're gonna welcome you with open arms. Okay?
I
When to
know,
call
I
your
remember.
doctors? Ha, di ba? I'm not even gonna ask. I'm not gonna bring up na lang your labor and IE experience. I will save that for when we have fewer audience members.
Yes, in private.
Uh,
But definitely the IE part, parang I was like, okay, don't do that. I'll give you candy or just don't do that.
in general, it's really hard to find a woman that has low reactions talaga to the internal exam. It's really not comfortable. Okay, so I can
Yeah,
I
so,
can I can't even imagine na lang. Let's just put it that way. Okay.
mm.
So
But
when to call
it
your
has
doctor?
happened.
Yeah. So contractions. One way that can guide you if you're the type of person that wants something hard and fast and solid. Maybe you can follow the 411 rule. So that means if you have contractions that are regular and progressing, that happen every 4 minutes. That's the 4 and the 411. That lasts at least one
Mm-mm.
minute, and that has been going on for 1 hour at least. That's the 411 rule. Then maybe you can give your doctor a call. Bloody vaginal discharge,
411.
especially the type that is profuse, dripping, or active. Anything with clots or anything that you find more than your usual menses, day 2 or day 3 of heavy menses, I think it's important that you call your doctor because it's important to identify where that's coming from. Baka it's not lang from the cervix. A
Especially if
leaking
you're
bag of
near
water.
term na. If you're
Yeah, or
almost about
maybe
to
you're
give
already in
birth.
labor. So you can use that as one of the guides as to when you're going to be calling your doctor.
Okay.
Another is leaking bag of water. Ladies, what you see in the movies, the cut scene where the woman will have a splash of water under her dress, cut scene, the baby's in her hands already. It doesn't happen most of the
Na,
time. Okay, these are the minority of women. Sometimes I mean a lot of times the bags of water will just be leaking. Nothing as dramatic as in the movie. So it's important to keep an eye out for such. And if you're one of those people who gets that, important to remember to report and take note of the taco. which is the time it happened that you notice that the bag of water has been leaking, the amount, the color, and the odor. So that's what the taco stands for, and it's important details
Taco.
that, yeah, that I'm sure your doctors are gonna be asking from you. So in case they ask where you got the information, please, yes, I'd appreciate a name drop that it came from me. I'm
Yeah.
just kidding. Para
Actually,
alam
no.
nila, wala na silang tatanungin eh. You're just gonna be blurting out the information. Doc, I mean, may bag of water, it happened with ganito, it's konti lang, with no odor. Okay,
So the taco.
i-reference ako dyan, okay?
Let's go back to this video. You watch this video, everybody. Go back to this video. So they'll remember
Thanks
that
for
part.
the mini commercial, yeah. Also, decrease in movement of your baby. There are a lot of different ways to test the movement of your baby, but in my opinion, the most important is your perception of what reduced movements for your baby is. Because after 9, 10 months of carrying your baby,
Correct.
you'll find yourself knowing when baby moves the most. Eh. For a lot of women, of course, it's
Mm-mm.
after eating, and for even more, it's usually at night. But there will be some women na parang may baby actually follows the sun, mas magalaw siya in the morning, ganyan, etc. And it really is super different for every woman. So if you tell me that your baby's movement has been decreasing, that's all I need to know. I'm going to be running tests na for you. Okay?
What about docking when you're asked to take something sweet para gumalaw? Like when you have it like ultrasound, di ba if you want the baby to turn,
Yeah, because it's when sometimes you find yourself your baby moving more after eating it, and this is the
mm-mm,
reason, the rationale behind asking women sometimes to get a snack outside first. If you're having
or
an
something
ultrasound
sweet.
and your baby's not good, something sweet, para
Mm-mm,
usually it wakes a baby, and a lot of times it actually works. No, I don't have
mm-mm.
the scientific evidence why, but it actually does.
Wakes up the baby. Not for
It wakes up the baby. Okay, and we're almost done giving birth at the hospital during COVID-19. My words for you guys are to just be a little bit more flexible and understanding, because I'm sure that there will be protocols that exist for every different hospital to protect you, all the other patients, as well as the healthcare team. So be prepared to wear masks or other personal protective equipment. I'm just letting you also know that for some hospitals, as I said kanina, testing for COVID-19 is mandatory because it helps them segregate or to categorize women as to where they will be placed in the labor room. So for those with infection, those with suspicion, or those who are untested, and those who are sure to be negative can be assigned different areas of the labor room to help in the standard operating procedures of the hospital and to keep things efficient and functioning well. And also, this is what makes me sad actually, but companions may not be allowed in. This might sound like a big sacrifice for a lot of women, but I think it's important that if it really bothers you, to talk to your doctors about it. But what I'm saying right now is it's absolutely possible that some hospitals won't be allowing partners in, even if they are, of course, part of the family, because they can be carrying diseases not only to the other patients but also to the healthcare team. I'm sure there's a reason for that. So sometimes we'll just have to adjust. But again, what I'm saying, if it bothers you, please talk to your doctors of how important it is to you if it really does sting you, this news. Okay. Parting words for
Right,
everybody,
Tama.
please select credible sources of information. There's so much information now, and now more than ever, you guys can probably tell how important it is to in selecting what you read, selecting where you're reading these things, because a lot of times, sorry, I'm back and forth. These things aren't real, or it's not founded, or the sources aren't
Mm-mm.
credible, and they can definitely affect your decision making. So, credible sources of information: Philippine Societies of Medicine, we have the WHO, and we have the CDC. Okay, avoid scary stories about pregnancy. I actually found some videos on YouTube about the worst horror stories or the worst labor experiences for women, and there's so many
Really?
women who watched it.
Oh
I
my.
think it hit a million pa nga eh. Like my concern lang is, why would you watch that? It's like riding an
Share
airplane and
that.
watching a video about plane crashes while you're on board. Because you're already
Correct.
pregnant eh. It won't help you.
Exactly.
And it's important to know that you
If it's
belong to the majority of women. And the majority of women will have very safe births. Okay, we have a very low
yeah.
maternal mortality rate now. So chances are, if we're gonna go all in on something, my bet is that you're gonna have a
Yeah.
safe and healthy birth. I'm just going forward and hoping that you guys have a meaningful and then a satisfying birth experience. Okay. finally, protocols are not set in stone. Be ready also for any changes that happen. Like one day I can be saying this about the COVID. In a week time, they might find some evidence that it's actually terrible for pregnant women. So please just be mindful about that and don't hold on anything too tightly. Get ready to adjust what you know, but it's still important to be in the know. So a lot of them, my parting words, hopefully they make sense and they help you a lot. Okay.
Okay, Doc. So meaning for
Thank
anything, just
you.
consult your doc. For any, thank you, Doc. Thank you so much. I have so many other questions, and I'm sure our viewers also have
Tasha, you're
questions that they
not
want to
pregnant.
ask.
You're not allowed to ask
I know,
questions.
yeah, I think not for me, but something that can relate, but not me.
I'm sure. I'm
So
just
there.
kidding. No, I'm just kidding. I'm sure you do because if you're looking back right now, I'm sure you have a lot of experiences that you can share, and maybe it can help a lot of
Yes,
the women. I'm
right.
joking.
Because I have friends who are pregnant, and I even have a friend who just gave birth, and you learn when you share, when you're able to sharing up by when you're watching a webinar like this, or like if you consult with a doctor, you just want to share the useful and helpful info. So I'm just very thank you, Doc Gina, for this one. And if the viewers, if you have questions, please just comment, leave your comments in the comment section. If you have questions there, maybe later on we could answer those, and so you could also participate in our raffle later. So thank
Thank
you,
you.
Doc.
Thank
But we
you
have
for having me.
we have questions, Doc. So
Hi,
there's
okay.
just a few questions now. Yes, Doc. So all right. So basically, well, basically it's just that like with the one for the pregnant women, diba, they go inside. So no more like swab test or nothing. They can just go no rapid test for the pregnant.
No, no. The protocols vary for every hospital. So for a lot of women giving birth who are near term or at term, a lot of times hospitals will require the women to get tested, whether they have symptoms or not.
Okay. So
So,
that's
but it
basically
depends. That's what I'm saying. The protocols for every hospital is different. So just keep an open mind about that. And you might want to ask your OB early on if the hospital that they work in or where you want to deliver follows that protocol.
or the swab, but whatever protocol it depends on the hospital.
Yeah.
Correct, Doc? Okay. All right. So actually, basically that's it. So Doc, again, thank you so much for sharing with us all those things. Very valuable. And guys, if you want to remember what everything that Doc said, you can just watch this video again or call Doc Gino. So I know, or ask your doctor, of course. So there.
Yes.
Thank you, Doc. Thank
Thank
you
you.
so
Thank you.
much. Thank you. All right. So moving forward, so we're gonna have now our second raffle. So are you guys excited? I'm sure the first one we had one earlier, and now we're gonna have our second. So before we proceed, let's find out who the lucky viewer is. So are you guys ready? Yay! Doc, di ba excited eh? Baka you dropped your name there.
My name's in there.
Did you drop your name also?
No, I'm just kidding.
Okay.
I'm just kidding.
All right. So the winner, okay, our second prize winner gets 1,000 peso GC from Nursery Van, and she is Miss Chiara Galinato. Chiara Galinato, congratulations. Stay tuned for instructions on how to claim. Okay. All right. All right. So just stay tuned. We'll get back to you on how you can claim the prize. All right. All right. So the second raffle, and now we move on to our next topic. Okay. So going back, now that Dr. Gino discussed a whole lot about pregnancy, as in all the information. Thank you so much, Dr. Gino, about that. And a lot of moms also are asking what happens after I give birth, because Dr. Gino discussed now in pregnancy and then childbirth. And what now? We want to know what happens after you give birth or after I give birth. Siyempre, giving birth doesn't end there, but after that, it's life outside, and you're gonna take care. And so a lot of moms wanna know what to do when they get back home. So after the hospital experience, the delivery, Dr. Jamie, what do I? Hi, Doc. How are you? Okay. So what do our new moms need to know about? What do they need to know? Like after the hospital trip, after giving birth, when they go back to the house, basic child care during this time.
Yes, actually, I'm going to be talking a little bit about what's going to happen in the hospital also, and then
Okay.
also when they go home, especially during this time. So just to start off, and actually, I'm jumping off from where Gina ended regarding protocols, because there's so many things that there's a lot of data that's coming in, and so we have to remember that protocols and these guidelines can actually change because we're dealing with
Mm-hmm.
something that's new, it's novel, so
Right.
we have to be ready for it to suddenly change. But what's very important is, again, to always communicate with your healthcare provider. If it's your OB-GYN, if it's the pediatrician, just make sure you're openly communicating with them so that you're aware of these changes. At the end of the day, these protocols are meant to help each and every patient, and of course the healthcare team. And
Right.
at and what's important is to make sure that make a shared decision, because as parents
Mm.
you have certain preferences, but of
Right.
course you want to make the best decision for you and your child with the
Mm-hmm.
guidance of your healthcare provider. So just make sure that you're
Sure.
openly communicating with them. So
Okay.
because there's so many things nga that have been going on, there's so much data from all over the world. What we do know is that, like what Gina mentioned earlier, there's no evidence yet that there's a maternal to child transmission of the SARS-CoV-2 virus. Okay, in the
Mm-hmm.
Philippines, actually, there's data that there have been 6 mothers who were positive when they gave birth, and they found out that the children, the babies who were born to these positive mothers, were all negative. Okay, so they all did not
Mm.
get the virus from their mothers, which is very good news. So we know
Yes.
that so far the data tells us that the virus is not passed on through the amniotic fluid, the cord blood, and through breast milk. Okay, so that's the information that we have right now. What we also know is presently there are many interventions that are already in place that will protect mothers and their babies. So we have the Unang Yakap. Not sure if some of the moms already know about this. So basically, this is
Mm-hmm.
immediate and thorough drying of the newborn, skin to skin contact after delivery, properly timed cord clamping, and non separation for early breastfeeding. We also have newborn resuscitation, early and exclusive breastfeeding. So these are already life-saving measures that are in place even before COVID. So these are important things that we want to protect as well. We also know
Mm-hmm.
that when we interrupt the skin to skin care that happens, it can interrupt the child's and the newborn's physiology. It can even increase the heart rates of the babies. It can increase the respiratory rates, lower their glucose levels compared to those who are in skin to skin contact. We also know that breastfeeding is considered as the baby's first immunization. So, given the fact that the breast milk contains a lot of the antibodies are the substances in the milk that will be passed on from the mom to the baby to protect that baby against infection. So that's very important when the baby gets it, at least in the first hour of life, so that breastfeeding will be successful. So we also know there have been studies that have shown us that when babies are exclusively breastfed for at least 4 months, it can decrease the risk of lower respiratory tract infection by at least
Four
30%. So
months.
so these are very good data that will reassure us. However, because COVID happened, we know that it's a
Mm-hmm.
real threat. It's a threat to all
Yes.
the mothers, to all the newborns, and of course to everybody. So why is this important for us to discuss? Because we also know that there's a lot of data that many people who don't have symptoms can be carriers or can be positive with the virus. Okay, so
Mm-hmm. Okay.
it's a little scary in the sense that we cannot be complacent na, oh, okay, this person doesn't have symptoms, hindi siya umuubo, so okay lang, we can
Yes.
reduce yung mga ganyan, no? And because of these things, there's always going to be a risk that maybe there's some moms who will be separated from their babies when they're born. There can be a chance that breastfeeding might not become successful because of these things that need to happen. So hold on. Okay. So if ever mothers right now who are listening are worried about this, we also still need to remember that the best COVID is basically these things. You have to make sure that you wash your hands frequently with soap and water. And then you make
Basic.
sure that you wear also a medical mask properly and know how to use it. And when you're breastfeeding also, if you have symptoms or if you know you're positive, then you definitely have to wear a face mask. Proper cough etiquette also is important. You know how you cough into a tissue and then you throw it right away and then wash, or if not, you cough inside your shirt, basic things like this. And disinfect and regularly clean surfaces, because there have been data also that you can find these viruses on different surfaces, so it's important to follow these things. Okay. If for whatever reason the mother cannot breastfeed her child at the moment, then mothers need to make sure that they have to protect their breast milk supply. So they need to express their milk at least 8 to 12 times in 24 hours. And then if for whatever reason the baby is not with them at that moment, then they have to be able to give the mom's express breast milk, either to dropper or cup. But make sure that whoever is feeding the child or the baby practices also strict hand washing. The mother as
The
well,
mask.
when she's expressing, and then wear a mask. Make sure everything is properly sterilized and cleaned so that we will decrease the risk of possible transmission of the virus. Okay. These are,
Kailangan kind of extra careful always now, especially nowadays. Super
yes,
extra kaduper. And
yes.
cleanliness of the hands and protecting.
Yes. What's good about what we know is that yes, it's very easy to catch it, but yes, it's also very easy to get rid of it, in the sense na, diba, you just wash your hands and then okay na. But you have to make sure you're doing things properly. Okay, so
Right.
for those who are planning to give birth in a hospital or wherever, just make sure that beforehand you talk to your OB, and or the if it's in a lying in clinic, you talk to the midwife and you ask them what the policies are, what the protocols are, so that you're prepared. Because
Yes.
sometimes what you don't want to happen is you go to a hospital tas hindi pala pwede, you can't give birth there, then biglang you need to look for another hospital. So you need to make sure
So
beforehand.
ahead
Yes,
of
ahead of
time, yeah.
time. Yeah, so part of preparation is also preparing your physically the things that you need. So for example, here is just a basic list of what the moms would need when they go to the hospital before they deliver. So, the onesies, going home outfit, mittens, booties, hat, burp cloth, swaddle or receiving blanket, a nursing pillow if they would prefer that, hypoallergenic baby wash, but usually some of the hospitals would have this, cotton balls for cleaning the diaper area, newborn diapers, but there are also a lot of the hospitals would provide this. Okay. And then for the mom, there's some moms who would like to write a birth plan so that she can already tell the doctors, kasi 'di ba madalas a lot of them ask so many questions paulit-ulit. So moms would like to just write everything down and then give it to the doctor para alam na nila what the moms would prefer to happen. Also, you want to wear comfortable clothes where you can breastfeed in. Socks and underwear, if you're malamigan, you can have a sweater. Don't forget to bring your own face masks as well when you go to the hospital. Slippers, maternity sanitary pads, toiletries, soap, shampoos, etc. Hand sanitizers, hairbrush, hair tie. So these are just very, very basic things. For the dad and whoever the support person is, if they are allowed to be there, then of course they have to prepare their change of clothes, slippers as well. Make sure your forms are filled out. If you have insurance, fill health. Make sure you also have water, snacks, your phone, your charger, camera, and again, face masks, etc. So when the baby is already born, the usual question that we would get is, how do we know if the baby is hungry, or when should you start feeding the baby? So what's important for moms to remember is that babies show early cues of breastfeeding. Okay? So meaning when the baby starts moving her head from side to side or stirring from sleep, it's already a sign that the baby is ready to breastfeed. Okay? Because if we don't mind them at this time, the next cues would be ito, yung mid cues. So they'll start stretching a little bit more, putting their hand to the mouth. And if you're still not minding them, mainis na siya. So late cues na yan. And then the baby will start crying, will start getting very agitated. And if you try to breastfeed a baby who's crying, agitated, 'di ba, hungry na, angry pa. So it's going to be so hard. So really what you have to do is to calm down your baby first. Make sure the baby is calm, not crying, and then you try. Because in the beginning, sometimes it's hard for moms to get it right. I mean, may learning curve din yan eh.
And
So,
right.
'di ba? Parang we want the best possible environment for them. So make sure that your baby is calm when you try to breastfeed. Try to breastfeed them. Okay, so
Good mood babies. Put them in
yes,
the good.
good babies if you can find that, diba? A lot of parents, actually, this isn't a whole breastfeeding lecture, but just very small snippets of what they can already try to remember when it comes to breastfeeding is how the latch will be. So you start off with the baby's nose close to the nipple. Actually, you want to put the nipple of the mom right on top of the baby's upper lip. And then you wait for the baby to open the mouth wide. Okay? When the mouth is wide open, you bring the baby towards you. And then allow the baby to suckle, making sure that the chin is tucked, touching the breast, like in this picture, and the lips are flanged open. So the latch should be this close and that deep. So I'll show you another photo of how we know that this is a good attachment. When the mouth angle is more than 140 degrees. So basically, the mouth has to really be big. The tummy should rest next to the mom's tummy. The ear, the shoulder, and the hip should be in one line. And the chin is always on the mother's breast. Okay? The cheek line is also rounded and no dimpling. Okay? So they can try to remember this one. Okay. When you're already told that your baby is ready to go home, so what do you need to do, or what do you need to remember? Make sure that you ask all your questions first while you're in the hospital. A lot of times now, moms and babies are discharged much earlier than it was before, and not to be discharged just because, diba, nimamadali sila, but it's because they also don't want them to be exposed in the hospital much
For
longer.
long.
But of course, you're not going to be discharged by your doctor na hindi kayo okay. So, but of course, you also have to be physically, mentally ready when you go
Correct.
home. So if you have questions, you ask it already. If
While you're
questions,
there.
yes, about bathing, burping, breastfeeding, you ask already. And also arrange for your baby's next checkup, whether it's going to be online first, and then whether your doctor will already see you in the clinic right away. But what's important is you have a way to communicate with your doctor, okay? Because it's very difficult now since the clinics aren't all open yet.
Right.
Parents are afraid to go to the emergency room. So
Right. They're concerned about the vaccines, how the babies will get. So,
yes. So when babies are born, there are certain basic things that we usually do, and it is here written here: newborn screening, hearing screening, vitamin K, hepatitis B, BCG. Okay, but for example, there are a lot of the hearing screening tests that aren't done because of COVID. So we have to be able to find out where we can do it outside of the hospital, if ever. But again, communicate with your healthcare providers so they're aware, and you're also aware of when and where you can do this outside of the hospital.
right.
Okay. So when you sorry. when you already have your baby at home, what's important to remember is to make sure that you feed your baby 8 to 12 times in 24 hours. Some babies can cluster feed. That means they can feed
Mm.
every hour, straight 3 hours, and then sleep 3, 4 hours. Other babies naman can do every 2 hours, every 2 hours, more regular. Basta what's important in 24 hours, it's 8 to 12 times. Okay?
8 to 12 times in a day, right?
Yes, in a day. 24 hours yun eh. So,
Mm.
from 6 a.m. to 6 a.m. the next day, ganyan. So, it's good to write things down kasi syempre, after
Mm-mm.
delivery,
Have to
lutang-lutang.
remember.
It's hard to
what
remember.
what did Dr. Jamie say again? Take
Oo,
notes,
yeah. So,
mommy.
you just take note. You don't even know the time or day or, 'di ba,
Mm-mm.
kung nasaan ka na. So, it's
Yes.
better to make a record of things. Breast should also start feeling heavier at around 3 to 5 days after delivery. So, that's something important that the moms should take note of. And around this time, the baby's poop will also start changing and will start becoming more greenish. So I hope you've all eaten your dinners because I'll just show you photos of the normal newborn poop. Okay. So that you won't be surprised that the first poo poo that will come out of your baby is the meconium, and this
Meconium.
is very black, tarry, sticky, and this is around the first day when your baby is born until maybe days 3, and then from days 3 to 5 you'll have your transitional poops from being very dark and black. It'll start changing to something a little bit more greenish, and it coincides with the time that the mom's breasts start getting heavier. It means it's already the more mature milk that's coming in. Okay, so when the poop starts changing, it's a sign for us that your baby is really getting your milk, because from days 5
Mm-mm.
onwards, the poo will start looking more yellowish. Others will be greenish still, but it will look for exclusively breastfed babies, it becomes yellow and seedy. So it's a sign for us that
Mm-mm.
okay, my baby's getting the milk because
Mm-mm.
her his or her poo poo is changing also. Okay.
That's a good
And
sign. She's getting the breast milk na when it's yellow, it's the breast milk
yes.
getting a lot already.
Yes.
Oh.
And then I just want to show a photo of this poo-poo. Okay. The poo-poo that has no color, it's actually an abnormal sign, no? And it's an emergency, and you have to tell your doctor right away. If
Oh.
the poo-poo of your baby looks like this, please tell your doctor right away. Okay? Pero
Right.
the more, because this could be a sign that
Light.
may bara yung an area of the what's this, the gastrointestinal area could have some blockage
Mm-hmm.
yung sa may bile niya, hindi na lalabas. So it's important that your doctor knows about this right away. So just so you're aware, the more color there is, the more green, the more yellow, it's actually better. But
Okay.
if the poo of the baby is white or grayish, then please inform your doctor. Okay?
Mm-hmm.
Okay. So,
Mm-hmm.
a lot of times, parents really worry about the baby when they're already out. Kasi wala namang kasamang ano yan, 'di ba, pamphlet na okay, how to take care of your baby.
Mm-mm.
So, it's
My
really
manual.
walang manual yan. So, it's normal that your baby will actually come out looking like there's a lot of peeling or cracking in the skin, and then meron siyang what we call vernix caseosa. So
Mm-mm.
it's like a very sticky whitish substance that's on the skin of the baby, which we don't actually want to really clean off right away because of its antibacterial properties as well. Keeps the baby warm. So it's all very normal. So don't be afraid if your babies look like this. Okay, eventually
Mm-hmm.
naman it'll get cleaned off. There are some babies also have Mongolian spots. So these are spots on the bottom of the baby, on the legs, on the buttocks that may look a little bit like bruises, parang siyang greenish, bluish na rash of some sort. So that's normal. It'll go
Mongolian.
away. Yes, we call that Mongolian spots. It will go away after a couple of months, sometimes up to a year or so. There's some babies also have very fine hair, which naakala parang sobrang balbon. So sometimes you'll see it on the back, on the arms. So that's called lanugo, and it's also normal for them to have it. So don't be afraid na they'll all grow up to be too balbon. Yung ibang concern ng parents eh. Okay, other things, we also have some babies who may have jaundice or yellowing of the skin. It's normal if it happens 24 hours after birth and beyond. So we actually don't really need to do anything. Make sure babies are breastfed well. Of course, your doctor will be monitoring this if there's anything, any intervention that's needed. But usually you just breastfeed well. Make sure that babies are also put under the sunlight when you're at home. Aside from the jaundice, we also have the milia. Milia naman is like,
Yeah.
yes, parang siyang mga small, very small white dots on the nose, on the cheeks,
No.
sometimes on the eyelids. So that's also normal. And then we also have erythema toxicum. Ito naman medyo reddish. They look like pimples a little bit on the face. It happens around days 3 to 5 after delivery and will go away after a couple of days also. You don't need to apply anything. It's part of it.
It's fine.
Okay, and then next we have the baby's head, especially when babies are delivered vaginally. Babies' heads can look cone head, like this baby, parang siyang kapot yung tawag. So, because the fontanelles are still open, yung fontanelles yung bumbunan on the top and on the back. So, you have to remember that the skull of the baby is not yet fully fused together because the brain still expands. So, dapat may space yung skull to grow as the brain of the baby also grows as it gets bigger. So, you'll feel na parang may mga sutures all around the skull. So, that's normal. Sometimes parents are worried eh. So, of course, you just have to be careful about the way you're holding the baby. Diba? Yung sa head,
malambot pa.
yes, malambot pa siya. So that one is still open. Okay. So when should you call? Because for you to know what's abnormal, you have to know first what's normal. So I showed you some of the normal things. Of course, there are a lot of other things that I didn't tackle here anymore. But you also would want to know when should you actually call your doctor, diba? It's very hard now to go to the emergency room. So if your baby has poor suck, meaning hindi siya nagfi-feed, most of the babies will sleep 16 to 18 hours a day. Okay, so that's normal to do that. But when they're awake, they should be actively sucking. Kahit mga 10, 15 minutes, some will do it a little bit longer, but they should be able to hit the 8 to 12 times in 24 hours. But if they're not doing that, or if they're vomiting, if their stools are very loose and watery and not like what I showed earlier, then you call the doctor. If your baby also is not consolable, iyak lang ng iyak for 3 hours straight, then you also call your doctor. Okay?
That's not a sign lang na that hungry. It's more serious na. So
yes, I mean, but if you're already trying to feed, yung parang nagfi-feed siya but not feeding, there's a difference din eh. Of course, babies will cry. Babies will naturally cry. It's their way of communicating. But then they usually can be comforted when you're cradling them, swaddling them, when you're able to breastfeed them. But if you're doing everything and it's been hours and hours on end, the baby is not getting consoled, then you call your
time
doctor.
to call.
Yes. And then if your baby also has weak cry, yung kunyari, at first, malakas talaga siya umiyak, but biglang hindi na siya umiiyak, then that's also a time to call your doctor. If your baby is ill or would turn blue or would have a temperature more than 38 degrees Celsius, usually babies kasi don't really get fevers. Yeah. But then if they do, then it's time for you to call the doctor.
Doc, quick
Okay.
question lang. Like now kasi it's very hot, right? The temperature. So,
Mm-mm.
pag newborn, di pa nag-water, right? So, basta breast milk lang. Tuloy-tuloy lang yung, that will
Yes.
hydrate them na,
Yes, because
keep
breast
them.
milk actually has 80% water. So you don't want to give breastfed babies who aren't eating yung first 6 months. You don't want to give
Mm-mm.
them water because they will just get full with water and it's not really going to give them any nutrition. Because breast
Mm-mm.
milk already has the water the baby needs. That should be enough. So be
Okay.
mindful also of the temperature around, diba? If it's too hot, make sure hindi naman siya sobrang swaddled. Okay, but if
Mm-hmm.
your aircon is full blast, then you can swaddle up your
Adjust na
baby.
lang.
Oo, adjust then. And then so bathing a newborn, what's important about bathing is making sure that you've prepared everything before you even start. So yung basin of lukewarm water, washcloths, mild hypoallergenic soap wash, and then you can have receiving towels also. So sometimes it's important to keep the umbilical cord area dry the whole time, and then you just wash the top first, the head, and then while the baby is swaddled, diba? And then lalabas mo yung hand, yung right
Mm-mm.
arm, and then the other one, and then you do the bottom, the buttocks. So, pwedeng ganon. Others would do
Mm-hmm.
straight na sa basin. So that's
The
also
tub.
okay, but it depends on how comfortable you are doing it. But just make sure that you always keep the umbilical cord dry, especially if it hasn't fallen off yet. Usually falls off after within the first 2 weeks or so.
Okay.
Okay.
To
And
keep it
then
covered lang so it doesn't get wet.
yes, but if ever it does get wet, it's okay, but just make sure you dry it up after. So
Okay.
regarding daily sunlight exposure, you expose the baby to sunlight between around 6 a.m. to 9 a.m., roughly mga 30 minutes front and then back, but just in a diaper. So you don't necessarily need to go out of the house. Pwedeng beside the window where there's a bit of sun coming in, and then pwedeng nakahawak ka. Ikaw rin, you need vitamin D because, all of us are stuck at home. So, there's some daddies who are also just in their shorts, tas nagsa-sunbathing din. So, we all need the sunlight, especially this time. And so, you make sure you expose all the body surfaces of the baby.
Okay. That's good to know, Doc. Kasi before, I thought you really have to go out to sun. But if may sunlight naman that goes inside the window, pwede na rin.
Yes, pwede na rin yan. Especially sometimes if
Okay.
it's too hot outside or if it's too cold naman outside, so mas makakontrol mo yung temperature inside the house.
Okay.
And then
Wow.
regarding umbilical cord care, what's important is to always just keep the cord dry. We avoid using the big kiss already. I don't know if there's still a lot of mga lolas who advise this, but we avoid using it already kasi sometimes it can even, babies actually breathe also with their bellies. So, mas lalong na-constrict yan, yes. And then minsan mas magkukos pa ng infection if you're covering the cord. You actually want to air dry it. And then when you're using the diaper, you fold the diaper in so that the cord doesn't get soaked. If ever there's pee, it won't go to the cord. And then next, regarding cleaning of the genital area, in the beginning, you can use cotton balls soaked in warm water to clean the genital area. Some would use wipes. That's also okay. Just make sure it's mild, hypoallergenic. There's no scent because the skin of babies it's really very sensitive.
Sensitive.
Yes. So hiyang-hiyang pa sila sa sa kind of baby wipes. So soap, I mean cotton balls that soaked in warm water is okay. And when you clean from the genital area towards the buttocks. So away.
Right.
So it's always going towards the buttocks, and then you throw, then pag ganyan. Hindi yung balik-balik na.
What after that out? Just there na throw away
Make
na.
sure you put up the yeah. So and it's okay to like clean all over. Make sure that there's no poo that's hidden in all the crevices because that is what will cause the rash, the diaper rash to come out. Okay, and then So lastly, I just wanted to end with this. All babies actually cry. So it's normal that babies will cry. This is how they communicate now. But
Communicate.
we also have to remember that babies less than 6 months cannot be spoiled. So it's okay to carry them, to cradle them, to hug them. It's very important for their brain development, actually, especially when they're breastfeeding. So you are your own child's advocate. You are also the best parent for your child. A lot of moms and dads um will have some parang insecurities, 'di ba? Not knowing if you're doing the correct thing or
Especially first time parents, like pag
yes,
first time,
especially first time parents. So even with me, I was already a pediatrician. I was feeling the same thing, 'di ba? So, but really at the end of the day, you are the parent of your child and you're the best person to raise your child. So, good luck and I hope everybody has a happy Mother's Day this weekend.
Oh, thank you,
Thanks
Doc.
for
And
having me.
thank you, Doc. And happy Mother's Day also to you, of course.
Yes,
Advance.
thank you.
Thank you so much.
So I
Thank
think
you for.
there's some questions then, diba? We'll go through that
Yes,
one.
we'll proceed with
Okay.
the questions after. All right. Thank you, Dr. Jamie. Every continuation from Doc Gino to Dr. Jamie. So continuing and so from the hospital and back to the house. Guys, you've heard it. So lots of useful info. Thank you so much for sharing to both Dr. Gino and Dr. Jamie. Thank you so much. So, so we're now going to proceed with the first, third raffle. So if you guys are ready, we'll proceed with this one first. Are you ready? Dun, 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 dun. Okay, here we go. Okay, so it's going to be Mother's Day soon, and we are feeling extra generous today. So we will draw another one worth 1,500 pesos GC from Nursery Van, and the winner is Miss Anna Lopez. Why? Oh, wage. If it's wage, so Miss Anna Lopez, wage or wahe. So congratulations. Stay tuned for instructions again on how to claim your prize. So congratulations, Miss Anna Lopez, wage or why. All right. So now we will accommodate our questions from our live viewers. So we're gonna start now. All right. Dr. Jamie, I have a question. I mean, from not me, but from
Yes.
Mommy Michelle Daria Salazar. Okay, so my baby doesn't have vaccine yet, and he's almost 8 weeks. Can they delay the vaccines, or would you suggest to bring the baby in the hospital now? What's your suggestion, Doc?
Actually, it's still important that the babies get their vaccines. Of course, you want to weigh the pros and the cons, about the risks and the benefits. So what we have to remember though is that just because COVID happened doesn't mean that all the other diseases stop. Measles is still out there, flu is still out there. So we still need protection also against that. So important to, of course, continue breastfeeding if you're still breastfeeding. Make sure your baby's immune system is very good, and you can do that by making sure they eat healthy, they making sure they sleep well, they get exercise at home, etc. But when it comes to vaccinations, you have to coordinate with your pediatricians because we are making sure that our clinics we are also protecting our patients from any possible transmission in our clinic. So right now we try to accommodate only one patient every 30 minutes to an hour. So usually shorter na yung consults because
But
but it's still important that they get their vaccines.
but these are e-consultations na, Doc, no? All e-consultations.
E-consultations for those who are sick, pwede. But vaccination, syempre kailangan in person. There's some who are doing parang drive-through or yung iba parang in and out lang. Ganyan. But for example, some measures lang is just make sure you wear a face mask. Only one parent is there. No one is waiting very long. Make sure physical distancing pa rin. So you can only delay for a certain period, but beyond that, parang we're exposing our kids to more risk. So
Mm-mm.
it's important that they really communicate with their pediatricians on how to go about it.
Right. Just keep the communication lines open for any
Yes.
questions
And I
coming in.
think even health centers are open, and I've had some patients who went, and then they're just given a schedule, tapos may physical distancing also. So,
Oh, that's nice.
yeah, so
So,
they have to know lang what are their options.
okay. So you guys heard that. So pwede pa rin. Basta we practice some of the social distancing and depends on the healthcare center or hospital. So that can provide
Yes.
naman. All right. Thank you, Doc, for that. So now I have a question for Doc Gino naman. Doc, so I have a
Hi.
question from Miss Charlotte Carola, from Mommy Charlotte. And the question is, do hospitals still allow husbands in OR during these times, or will I be alone both during and after delivery? I mean, have you experienced that? Like what you mentioned that a while ago, na it might be hard, but you have to discuss,
Yeah,
right?
Charlotte.
So,
In general, of course, companions are discouraged nowadays because of the extraordinary situation that we have. So it'll require a little bit more understanding on your part, because for years now, it's actually been the norm to have your partners with you as you labor and give birth. Of course, they're part
right.
of that. Of course, they have to be there, but we also have to understand a lot of things are going on now that we don't really want to happen, and one of them is of course COVID, and we have to do
Mm-mm.
our part pa rin kasi paramount pa rin is to prevent the spread. So
Mm-mm.
in case that is gonna happen, which is my thoughts are it's probably gonna happen, I'm just gonna
Mm-mm.
ask for a little bit more understanding on your end. But I think it's better pa rin talaga to be able to talk to your doctor about that. Kasi
Mm-mm.
your doctor can be able to can be giving you more hospital specific advice, as because it's gonna be dependent on where you're also gonna give birth, etc. But what I'm saying is
Mm-mm.
generally it's not. It's usually they're usually discouraged from coming in na talaga.
Okay, because I don't know how long they will stay in the hospital after the delivery. Like, will they
Yeah,
be
it
allowed to go
depends.
home?
Oh, it depends naman. Sometimes, of course, the doctors will also want the patients to go home as soon as possible. So sometimes after an unremarkable birth, sometimes after one day, you can already go home. It really depends on
Mm-mm.
how fast the woman is recuperating. Is she feeling okay? Is the bleeding minimal lang? So a lot of these
Mm-mm.
things are taken into consideration, and it's really hard to find a one size fits all for everybody. But what I'm saying is, if everything is goes well, and you for most it will, you really aren't going to be staying in the hospital for a long time.
Okay, so and that's only for now lang naman eh. Eventually,
And it's
hopefully
only for now.
positively.
That part, yeah,
Mm-mm.
that part about the companion not being there, it's really only now. I
Mm-mm.
don't see any other thing that can get in the way of your partner not being there. But this virus talaga, it's so
I
contagious,
know.
and
Yeah.
the hospitals are just doing their job. Of course, the hospital wants your partner to
Mm-mm.
be there because it's part of the whole process. Your partners. Pero yun nga, just
Mm-mm.
asking for a little bit of leeway lang right now, for a little bit of
Mm-mm.
space and understanding.
I see you on Mommy Charlotte. So
No,
that's answered question. I hope Doc was able to answer your question. So thanks, Doc Gino, for that. And now, Dr. Jamie, again, another question. If it's here, so we proceed. Mommy Izel
Yes.
Carbunco. So her question is, what do I need to give my 4-week-old baby to strengthen his immunity? Vitamins or any, what would you recommend to give to strengthen the immunity, especially these
Actually,
days? So,
the best thing at 4 months, diba? Actually, a 4 month old
four, four,
baby,
4 weeks. It's 4 week old.
sorry, 4 weeks.
4 week
Okay, a
4 week
4 week
old baby.
baby just needs the mother's breast milk to
That's
strengthen the
enough.
immunity. Yeah, that's enough. You don't need to give anything extra. However, there are some studies and recommendations for exclusively breastfed babies to actually give vitamin D as supplement. So vitamin D drops can be given 600 IU per day, but there are some who will expose their babies beside the
Fun.
window, get
Uh,
sunlight, because you can get vitamin D from that also. But
right.
really, the best thing is just to give your breast milk and your love, and that's
Yeah,
all
like
they need.
the liquid gold, right? The breast
Yes,
milk.
yes,
And it's so convenient because you don't have to go buy outside and go out of the house because it's just there. Latch lang.
hmm
And It's there
Yes,
when you
especially
breastfeed.
now because they have to remember that you the mother is exposed to the environment, and your body will produce those soldiers that will fight
Right.
against whatever exposure you have. So you pass it on to the babies. The baby's immune system isn't very well developed yet, so it's your
Mhm.
job as a mom to give that protection, and the only way you can pass it on at 4 weeks is through your breast milk. They're not gonna get that anywhere else.
Right. The best for babies. Thank you,
Yes.
Doc. Thank you for that. And Doc Tino, all right, and what? We received quite a few questions on the required vitamins to take during different parts of their pregnancy. So,
Yes.
and which laboratory tests are required, especially during the pandemic. So, is there anything they can do to help boost their immune system?
If the women are asking for specific vitamins that can boost
Vitamins
immune system, definitely
during
vitamin
pregnancy.
C and zinc. Yeah, vitamin Z and zinc are both known to improve your immune system. However, if we're gonna talk about mandatory or required, absolutely required na multivitamins, generally it's not absolutely given to everybody. However, there are
Mm.
essential elements or minerals or substances that are still necessary, and it depends on the age of these pregnant women. So for the first trimester and even before getting pregnant, it's usually folic acid that you'll be hearing. So a lot of women who are trying to give birth are
Mm-mm.
usually given folic acid already and up to the early part of the pregnancy. And then as you move on, when the vomiting's done, this folic acid sometimes is continued by some, but for some they will discontinue and then they'll be shifting to ferrous sulfate, and this ferrous sulfate is like an investment, this iron. So iron is given because we're expecting, of course, that in pregnancy, in birth, that the women are going to lose some blood because there's really going to
Mm-hmm.
be blood when you give birth, whether it's going to be a vaginal or hopefully not, but I mean, but some for some cesarean sections also. So we're starting early with these supplements, and there are some nuances for each and every one, how best to take it, when if it's best taken with other certain vitamins. So for these things, it's very important that you talk to your OB because these things are going to be individualized, especially based on the results of the laboratories that your doctors will ask you to do in the beginning of your pregnancy also.
Mm-hmm. And
Okay,
of course,
but
eating.
if you're but if the worry of the pregnant women right now are, I haven't seen my OB in 2 months and I might be needing a vitamin ASAP. No, there's really no absolutely required multivitamin. But when it comes to the folic acid and for the iron, it's very important. And I'm assuming or hoping that you're already on one of them.
And it's also what you eat during this time, di ba? Because like vegetables, di
Definitely.
ba? So,
The
and
reason naman supplements are here is because we really can't guarantee, not only to ourselves, but to the doctor na that I'm always gonna be having a colorful plate with
mm-mm.
different with meat, with vegetables, with fruits in good portions. So that's the reason these supplements are coming in.
The Go Grow and Glow food. Go Grow and Glow.
Yes.
Don't we turn that
Sila.
at
Yeah, but I think the problem is the glow. It's the
it's
part that's not the tastiest. So, but it's the source of a lot of the stuff that we're using as supplements. So,
right. So if it helps, usually it helps a lot, the vegetables, but cause ano
definitely,
lang, just eat
definitely.
it.
If you're one of the major, if you're me like me or the other parts of the population that can't guarantee that we eat very healthy all the time, well then maybe a supplement is right for you. And I think it's gonna be your OB who's gonna be best be able to determine what's right for you.
Correct. Thank you,
Okay.
Doc.
Yeah.
Thank you, thank you. And then Doc Jamie, from Nikki Chang, do newborns get COVID? What symptoms should I be aware of? So basically, it was answered I guess earlier in the talk. Remember? Mm,
I'm unmuted.
yeah.
Sorry, I was muted. Okay, for anybody, there will always be a risk that you can get COVID. Um, but there's no studies or data that will say that newborn babies have a higher risk. In fact, among the pediatric cases, they have seen that most of those who do get it have mild to moderate symptoms. If ever, those who get more severe symptoms are those who have other medical issues or other medical conditions. So um, what we know though is that even mothers, like what I said earlier, even mothers who have COVID, they were not able to pass it on to their babies during childbirth. They
Mm-mm.
also did not get it or did not turn out positive in their amniotic fluid or in their breast milk, etc. So the possibility of transmission can be from outside, diba? If there
Mm-mm.
are people in the household who are with you who may be carriers also. So that's why it's still very important that you practice hand hygiene, disinfect surfaces, etc. Yeah.
Protection lang, inside and out. Whether
Yes.
you're out or inside, just stay protected and
Yes.
clean.
Yes.
Thanks, so. Then a question from Anne Cholo for Doc Gino. Her friend is due on the third week of May and wants to know whether she should consider or if you advise a lying in clinic to give birth to her first baby due to the COVID-19 widespread in the nearest hospital from her place. So
Okay, lying-ins are
lying in.
lying-ins are very safe places to give birth, and I say that because part of their SOPs or standard operating procedures is that the doctors or the midwives inside help in categorizing or stratifying the women as to whether or not they're going to be low risk or high risk. No, and
Mm-mm.
also part of the way they function or operate is that they have a way in which that in case a low risk woman who can give birth in a lying in labors and does encounter a problem, part of their service is that they always provide a way in which they can provide medical backup in a hospital and help bring you to that place also. So actually, the person that
Lying
can best be able to answer that question for Anne, I think
for Anne.
the lady's
Angela.
Ange. I think Ange, the
Ange.
best person to be able to answer that for you is actually well, it's gonna be uncomfortable or weird asking your obstetrician that. So maybe I think you should be able to see that lying in that you're eyeing. I think that it's important that you get checked up there because if what your plan is to go to the lying in when you're about to give birth, it's not gonna be a good idea. It's very important that they know you, that they are able to advise you, and that you know the ins and outs of what it takes to be able to give birth in a lying in. But whether or not you're asking if these places are safe, yes, they're safe, but only
Just best
for the
research.
properly selected pregnant woman. And it's the meeting or the consult with the obstetrician that can help in determining whether or not you are a good candidate for a lying in or not. So it's important that you get a consult na Ange in that lying in.
Like to inquire first and to check, observe, or to
Definitely.
get
Oh,
a
she
referral
needs a
or
checkup. Yeah.
someone can recommend that or
Yeah, I
get
don't think it's gonna be your
recommendation.
obstetrician that will tell her that.
Okay, thank you, Doc. All
Okay.
right, thanks, Doc. All right, Dr. Jamie. So this is from Miss Mommy Lynn Lopez. What can I do to keep my house COVID free, especially now? I mean, with newborns, what should you do?
I'm muted again. Sorry. It's
Okay,
because the kids are around here. Yeah, that's why I had to leave a while ago. So
okay.
really to make your house COVID free, just practice the usual disinfection of surfaces, cleaning of
Mm-mm.
surfaces, making sure also that those people who are in your household, you monitor them if anybody has symptoms, especially those who go out for the runs as much as possible. You still want to keep everybody at home and do not go out unnecessarily because what we're afraid of would be yung mga asymptomatic carriers eh. People who
Correct.
don't know that they are carriers. So, you still have to be careful. As much as possible, we want to limit the people who are taking care of the baby to maybe just the mom or the father or whoever else will help para hindi pass on si baby. But generally, what I mentioned already earlier about wearing a face mask, physical distancing, hand washing, etc. should be enough. And keeping everybody at home as much as possible should be enough protection.
To be COVID free, for the
Yes.
home to be COVID free. Thanks,
Of
Doc.
course, we cannot guarantee that 100% because
Yes.
it's really very very difficult. So take all the
Mm-mm.
necessary precautions as much as possible.
Precautions. Right. Thank you, Doc. And then, of course, we have here for Miss Rain, Ason Manyo, and her question is, what is, for Doc Gino pa, what is the risk to pregnant women of getting COVID-19? Is it easier for pregnant women to become ill with the disease? That's your question.
Yeah, based on the current evidence that we have, for pregnant women to acquire the disease, it's not any more easier for them to be able to for them to acquire the disease. So that's one of the questions, is the ease with which to get infected with the disease. The other another important question that I should add after that would be, if in case they do get the disease, which I was
Mm-mm.
able to say kanina, if they do get the disease, is it going to be worse for them? And so far, current evidence says na it doesn't look so. It doesn't seem so. It doesn't seem like the disease is worse. The COVID-19 hits pregnant women harder than the general population. And actually, they found that maybe it's because of the age group of the pregnant women, because they're generally younger. And the younger age group is generally spared the higher risk of having moderate or severe severity of the COVID-19 if you get hit, compared to the elderly or the senior citizens.
Mm. And the immune system nga. So, that's nga.
Yeah, actually, if you talk about it theoretically, you're expecting pregnant women to be hit harder. What I also said earlier, like with the SARS and with the MERS, wherein
Mm-mm.
we found that pregnant women that get affected or infected by those are affected more severely, and that a third of them, I think, are have severe illness, but it doesn't follow suit with the COVID-19. So thank God na lang na
God,
that's how
yeah.
it's way. That's how it is
Mm.
with this very infectious disease.
Right. Thank God. But at least safety notes yan
Yeah,
para hindi lang.
yeah. I'm not saying this as
Protected.
license, because yeah, the next day pregnant women are gonna be go into the grocery. Okay, let your partners do that, but then stay at home. But I mean, in
Oh,
general, if you find yourself outside, fear not. Just take the usual precautions, because compared to a regular person in the population, current evidence says you're not gonna be hit hard. It's not easier for you to contract the
mm-mm.
disease. Okay.
Good to know. Good to know
Mhm.
that, Doc. Thank you. Thank you for that. So again, thank you, Dr. Gina and Dr. Jamie. Thank you so much.
Thank you.
A
Thank you
lot
for
of
Also,
having us.
us.
Thank you. Actually, a lot of questions. And if you guys have some more questions, you can post it there. We'll make sure to send it to the doc. Maybe they'll be able to send back their answers next time. But thank you so much. Very useful info. Thank you for sharing. Hey guys, thank you for your time.
Thank you, No Compromise
Thank you
Parenting. And happy
also.
Mother's Day. Tasha, Doc Jamie,
Thank,
thank you. Happy Mother's Day to everybody,
thank
to our
you.
listeners also.
Thank you also,
Happy
Doc.
Mother's
Thank
Day
you.
also.
Happy Mother's Day. Okay, but now we're gonna have the raffle draw. So it's time to draw our grand prize winner of the 2,000 peso worth GC from Nursery Band. The grand prize is here finally. So it's so fun because after hearing all of those and helpful notes and advice and from our doctors, the two doctors guests today, it's nice, and you got to find out new info, which is good, helpful, and now at the same time with this session, you're also getting rewarded through the prizes. So to continue now, and the winner for the final raffle, the winner is, and this is her Facebook name, Miss Rain Ison Manyo, the grand prize winner. Congratulations! Woo! So congratulations to our lucky viewers, to everyone, all those who won. Congratulations! And we for all the lucky winners, this is very important for you to be able to claim your GC. Please send a message to No Compromise Parenting's Facebook page, and they will let you know how to claim and use your GC at Nursery Band. So don't forget that. Very important. You have to send a message to No Compromise Parenting's Facebook. So that they'll also know what to do. All right. So everybody, that concludes our webinar today. I hope you guys, thanks everyone, to all those who joined and participated and sent their messages and comments. Thank you so much. Thank you, Dr. Gino Santos and Dr. Jamie Isip Kumpas. Again,
Thank
thank you for
you.
joining.
Thank
Thank you.
you.
Good evening. Yeah.
Thank you. We really learned a lot. I mean, super. Even I learned a lot and adjusted. Even if, like, my youngest is now turning 5, but even if you're first time or even second time, you're still continuously learning it. So this is a good thing
Always.
for you also. Yeah. So Kaizen, continuous improvement and development and learning. So, all right. Thank you so much, Doc. And we learned a lot. So we hope that the session helped a lot of our moms. And so moms, let us make sure to be reminded of the do's and don'ts especially in ensuring our home is virus free. And as Doctora Jamie mentioned, so and Cradle helps you achieve this with their toy and surface cleaner, which is actually just spray and wipe. So easy. I use that here at home, so it's so convenient. You just spray and then wipe, and you're already rest assured you're already you feel confident and happy that you were able to disinfect. So very good for that. And this product is actually made from natural antibacterial ingredients that kill 99% of germs. So 99%. So this is a must-have for those moms with kids of any age. Okay, any age, even if a teenager, young one, or anyway, if you don't have the usual like disinfectant sprays, you can use that also because it really helps. It's a toy and surface cleaner. And what's great about it is that as it effectively it cleans your toys and baby toys and other surfaces. It is also non-toxic and free from alcohol and soap. So that's important, non-toxic. So just and good news that now they actually now have their refill pack and you can buy them at www.nurseryvan.com. So don't forget for your one-stop shop for all the baby and mommy parenting essentials over there at www.nurseryvan.com. So thank you so much to No Compromise Parenting and Nursery Van for all the prizes, the GC, and for making this possible. Again, please don't forget to follow No Compromise Parenting on Instagram at No Compromise Parent and Facebook and be updated on the latest parenting tips and advices, especially to those with questions that we weren't able to accommodate. So just leave us a message there, an email, and we'll get back to you on that. So make sure to check the No Compromise Parenting's uploaded videos. And again, make sure to follow their Viber community. So they're also there at Viber. So easier for faster communication also on Viber. All right, for real-time advice and tips on parenting. And of course, don't forget to check out, again, www.nurseryvan.com as well for your one-stop shop mom and baby essentials, as I mentioned earlier, delivered to your doorstep. So thank you very much, everyone. And advance happy Mother's Day to all those who watch. Thank you. And to all the moms out there and dads, dads, happy weekend. Enjoy the rest of the day and the evening. And see you again soon. Bye. God bless.
Bye.